Hi, and welcome again to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the fourth exercise and fourth video in the knee replacement exercise program number 2. This exercise is called a single leg stance, and I'll show you exactly what that is in just a minute. But let me tell you, this is one of my favorite exercises, and most of my patients really enjoy doing this exercise. Some will even come back to me and say, I had my spouse try this, or I had my kids try this just to see what they could do. It brings out the competitive side in a lot of people. This exercise, though, with this exercise, you will find that your balance will actually improve a little bit every week that you're performing this exercise. And balance is just as important after this knee replacement as strength and endurance is. So it's going to just give you a better ability to walk across the floor, walk up and down stairs, walk over obstacles, curbs, and other things like that outside. So balance is really, really important. So let me show you this exercise and just have some fun with it. This is the starting position for the single leg stance, and its name is exactly what I'm demonstrating. So standing on one leg, single leg stance. And when you first do this exercise, I want you to make sure you do this next to your kitchen counter or kitchen table, because you probably are unsure of what your balance is like, and I don't want you to take the chance of falling. So make sure you do this next to a stable, sturdy surface when you first try this. Also, I want you to test the non-operated leg or your good leg first so that you know what normal is. Now, if your good leg is not so normal, which is the case for a lot of people with knee arthritis and knee pain, then you will have to go by what the norm is. You can also just test your spouse and see what's normal for them. But the norm for this is anywhere from 10 to 45, 50 seconds. And there are actually studies that show the younger you are, the more you should be able to hold this up to 45 or 50 seconds. And that's in your teens and even into your 20s. The older we get, we lose a few more seconds every decade to where people in their 70s have actually been tested with this. And anywhere from 10 to 16, 17 seconds is normal for this particular exercise. Again, this is the starting position, and you're just going to, let me just show you from the side, bend your good leg up behind you like that, and hold that leg there, and you just want to see how long, how well, and how long you can hold your balance. Every time you start to lose your balance, or you just need to take a rest, just put your good foot down on the ground, regain your balance, bend that knee again, and start over again. When I do this exercise, I just tell my patients they can count out loud or they can count in their head, and counting to that goal. Again, when you need to gain your balance, just put your foot back down on the ground or take a rest. And when you're ready to go again, just bend that knee. Now, where should you feel the muscles working in this exercise? Most of my patients will say they feel that I feel a good burn in the muscle in the bottom of the foot, anything around the ankle, up the back of the calf, even the back of the thigh, and into the glute or the rear end. And so if you're feeling it in any of those muscles, then you know you're doing it right and you know you're doing a good job. I want you to do 2 sets of 10 repetitions for this exercise. So for some of you, if you can only hold that a few seconds at this point as you're first starting out, that's perfectly normal, and this is going to take you not much time to get through. If you're able to hold that longer than that, so 10, 15, and 20 seconds, it's going to take you a little bit more time, but still, all in all, very doable. And I would like you to get this in at least once a day. But like I said, this can be done just about anywhere. So get this in twice a day if you can. You can even do it more often than that if you really want a good challenge. And this brings out your competitive side to see just how fast and how well you can improve that balance.